and welcome to the Vodafone Centre for Health Perspectives. I'm Katrina Lowes and I'm joined today by two wonderful health experts, and we'll be talking about the future of transformative technology in healthcare today and tomorrow. With me is Anne-Marie Vine-Lott, who leads the Vodafone UK Centre for Health, and Professor Shafi Ahmed, award-winning consultant surgeon, teacher, innovator and technology entrepreneur. So welcome to you both.
Thank you.
Thank you.
So when it comes to innovation and transformative technologies in healthcare, the future's not really that far away. Tell us a little bit about what you think the metaverse is going to do for transforming healthcare, Anne-Marie.
So I think of the metaverse, and my initial reaction is to smile, because I think everyone associates it with kind of computer gaming and that type of environment. But actually, this is something very real and something we can really tap into from a medical perspective. And I think that falls into three areas. It's actually for the patient experience itself and how it could help, for example, in childcare, whether it's for pain aspects or calming aspects, in mental health. It's whether it can help from an enterprise perspective, and it's whether it can help from an employee perspective, and particularly with regard to training, which is the one where, from a cost efficiency perspective, we can see there would be some real advantages. We touched on the use of proximity with remote training in surgical environment earlier on. This is exactly the type of space that you could explore that type of thing further, but apply it to anything, because training is a huge capacity issue within the NHS.
And what are some of the use cases today you're already seeing, Shafi?
So yes, the metaverse is an interesting concept, of course. And what we're seeing are real use cases. Let's go back a fraction. Virtual reality is one of the components of the metaverse. And over the last 5-6 years, we've seen many clinical trials around the world, particularly at Cedars-Sinai in Los Angeles and in Belgium, where 1,000 patients have been shown using VR therapy to improve their symptoms and conditions. For example, stress, anxiety, depression, post-traumatic stress disorders, as well as rehabilitation, for example. These are key wins. Imagine going into the metaverse as a patient and experiencing something that will help you. And the other thing is mental health. We've seen the issues around mental health over the last 3 or 4 years, highlighted by the pandemic. And actually mental health could be improved by doing well-being, mindfulness, etc. These are things that we've seen to be of advantage in the metaverse. The other key win, I think, is education. I think Anne-Marie alluded to earlier. And we've seen this remote learning now, remote education, particularly in medicine, has been revolutionised by using these kind of technologies. VR education, running classes. In fact, at my university during the pandemic, at Queen Mary, and the medical students, because I was already doing remote training, I had put them into my metaverse, my own Prof. Shafi auditorium. It was like a little university, and I called it the Metaversity. They came in, we taught one another, and they really enjoyed the experience, because they're digital natives. The young medical students of today are digital natives. They want to do different things. And what Metaverse offers is another option of education. We have e-learning, online platforms, we have telemedicine platforms, and now we have this VR, AR Metaverse. It's just another arrow to your bow as a teacher to offer a different experience. More importantly, it connects people. Yep. So I think about connecting people remotely. How do I teach people on a global scale? And this is one option that we have to improve access and to democratise education.
Because that sounds to me like a perfect step forward. I think I read somewhere that we've lost more than 1 million opportunities for doctors and nurses to experience surgical procedures because of lockdown. How are we ever going to catch up that lost knowledge? 3 years, I guess, of lost experience and lost knowledge. Is metaverse and access to remote expertise going to do that?
So remote expertise is one, to get experience, but also simulation is a big key. So if you can simulate a surgical procedure, a medical procedure, for example, on a regular basis to improve the skills, that shortens your training, improves your training. So one of the things we've done in the past, when we were analogue, we were actually going into the operating theatre and operating for the first time. Can you imagine? Not going through a simulation before that. And I went through that whole training myself. Now we're saying, actually, before you go to the operating theatre, can we do the simulations in VR, in the metaverse, get you to a standard. So when you go into the operating theatre, you know the steps, you know what to expect, and the environment. And what virtual reality also offers you is understanding the environment you're in. When you're first in the OR, as a junior surgeon, it can be intimidating, having all the noise around you, people around you, the patient, for example. It takes some of that away by creating that kind of social learning of the environment. So there's a number of things that I think is advantageous, allows us to shorten training, become more efficient, and then to improve the training in real life.
I think the young people aspect of that is really important. Actually, my son is at university now, and actually because they've been through COVID and how they've studied in their GCSEs and their A-levels, actually is far more open to learning in that methodology than anything else to some extent. He sees that as being far more efficient, far more effective, and he doesn't have to travel in the same way. So actually, I think it's something that very much is a trajectory forward, and particularly with the ones who are coming up and into, if you like, that healthcare model through their training now.
And I think one of the things we've heard a lot about is the loss of expertise from the NHS. Is this one of the ways that we potentially will retain, you know, young and upcoming doctors, nurses, practitioners, because it's a different way of working, a different way of caring, I guess?
To be fair, I think that applies across the whole technology stack. I mean, we've touched on the kind of patient experience, but workforce is one of the big challenges in the NHS, and retention and recruitment are key aspects of that. So, you know, the technologies that we experience day by day, whether that's through our various devices that we've got, you know, it immediately got a deficit when you walk into how you're trying to manage a technology environment in a hospital, depending on where you are, obviously, but immensely different. So, you know, we do need to make these investments such that we can recruit and retain staff. They are walking into an environment where technology is an enabler rather than actually, you know, making it something where it's more challenging and more fragmented. There's no reason for that to be the case. You know, obviously there's money, obviously there's training, obviously there are obstacles along the way, but in working in partnership and in sharing best practices, we can very much do something about that.
So that future doesn't seem very far away. What are some practical steps, Anne-Marie, that a healthcare chief executive could be doing today?
I think one of the things I was talking about recently, that the partnerships word, I know I mention a lot. I think it's hard for individual NHS organisations to actually do these things on their own. They don't have the confidence sometimes, or don't have the legal backing, which obviously costs money in itself, to actually go out and contract with private sector or even third sector organisations. And so there's a hesitancy, there's a reticence, because you're held to account so much within the NHS for risk, that actually this feels a very risky endeavour. So all of the focus goes on keeping the lights on, keeping the services intact, service continuity, completely understandable, but creating some templates, if you like, for how we could work together across different sectors would actually be really helpful as a way of unlocking some of the obstacles at the moment.
And I think one of the things that I really kind of started reading about is the idea of using everyday objects to get early understanding of change in potential healthcare indicators. So I saw a great story about potentially slippers being able to pick up if you're slightly unsteady, or potentially, you know, the way that you hold a pen could indicate a hand tremor. Is that a possibility? Where do we see that going, Shafi?
So we often talk about the Internet of Things, and now we talk about the Internet of Medical Things.
Yep.
And I actually talk about the Internet of Surgical Things, for example. So we talk about this kind of wearable sensors, getting data from everything that you wear, from your shoes to the way you hold a pen, as you've suggested, to bring data. Now, if you think about where that might be of value, so patients with Parkinson's, for example, might be able to assess the drug therapy around how he or she holds the pen, the tremors, for example, associated with it. Patients that have recurrent falls can be supported by a technology that allows to measure that and to perhaps warn people about falling. So it's those kind of things about saying, actually, how does that technology work for different patients, different vulnerabilities, to make it more personalised? I think that's going to be the key going forward. Even if, for example, we look at people in beds in hospitals, we have now sensors around the ward and looking at the heart rate, the temperature, the breathing rate. What that allows us to do is look at patients that might deteriorate very quickly, earlier than you might go by examining a patient. So having those early warning signs might prevent complications or severity of illness, giving you alarms and warnings way before it happens. So I think it's really exciting. How we use it remains to be seen, of course.
I think this is a really interesting space. So yes, we are touching on IoT. I think what we're also moving towards is, it's all very well putting some of these things in the hospital. Actually, we need to kind of pull it all the way back so that we're moving much more into the preventative space, and obviously the long-term condition type space. So if you think about the pressure monitors you mentioned with the slippers, it's a very good example. There's some technology that now is in the actual clothing that is you know, you could, that again is possible and is viable now. It's how do you join these things things together, and how do you start identifying through machine learning, through AI, again securely and with 5G, how these things can be joined together to actually identify the vulnerable individuals. I'm going to emphasize the data part of this again, because I do think this is a system-wide component. If you have, for example, data from utility companies, energy companies, to help with fuel poverty, to help with health inequality, ultimately, pulling together some of these data sets would again give you some of the early warning signs that actually would identify that individual before they've hit the point where they would normally go into care.
So I think this is a really interesting topic area, and certainly future Vodafone perspectives to be discussed, I'm sure. So the future of transformative technology in healthcare is so much closer than we think. Thank you so much, Anne-Marie and Shafi. Great conversation today. If you want to find out more about some of the stories that we've talked about here, check out our website. There's some really inspiring case studies of hospitals and healthcare providers that are adopting transformative technology already. And if you'd like to speak to our health team, the details are on the screen. Thank you, and we'll talk to you soon.